Okay, grade 12. So after I switched off, I saw that the whole of the endocrine system video did not tape. So I'm going to do it again. And I also see that every time I walk in front of you, then this goes blurred. But hopefully you can have your notes out with you now. Okay, so just quickly, I'm going to try and remember everything that I said on the Google Meet with regards to the endocrine system. You remember that you need to know what glands, there's a number of glands that we need to know about, we need to know where they're found, and we need to know what they secrete. So, the ones that are in brackets, they do not need to be remembered, but at the base of the brain is a region called, it's not really round, the hypothalamus, it's the base of the brain, and below that is the pituitary gland, and it's got a front lobe and a back lobe. It's like a little pea. Looks like two halves hanging below the brain, and you do not need to remember which half, front or back, secretes which hormone. So it secretes thyroid stimulating hormone, growth hormone, you remember follicle stimulating hormone and luteinizing hormone from when we did the menstrual cycle, and prolactin. Alright? Then the hypothalamus, which is linked obviously to the pituitary gland, secretes oxytocin. We actually didn't mention that on the Google Meet, and antidiuretic hormone, or ADH. But then it goes through the pituitary gland and into the blood system. Just depends, is it made there or is it made in the pituitary? But that's detail, so please don't, if you see stuff on that, don't learn it. Then you've got the butterfly-shaped gland in front of the trachea, below the larynx, below your voice box, and it secretes thyroxine, and don't worry that it's called T4, there's T3, which becomes T4, don't worry about that. You've got the parathyroid glands, 4 of them, little glands in the actual butterfly. They secrete a hormone that controls calcium. You don't need to know that. All right. Then the other endocrine glands that you need to be familiar with, the pancreas, which secretes insulin and glucagon, and the adrenal glands. They're actually attached to the top of the kidneys, little triangular-shaped glands that secrete adrenaline amongst many other hormones, corticosteroids, which you don't need to know about. And then if you're male or female, the gonads produce testosterone if you're male, and estrogen and progesterone if you're female, and then you've got all that variation in between as well. Okay, so now in grade 11, we did not do the nervous system, but that's okay. So just to compare, all right, so the nervous system is nerve impulses, which I did tell you about in grade 10, how nerve impulses pass along neurons, sensory neuron, interneuron in the spinal cord or brain, multipolar neuron, motor neuron to the muscle, and then it contracts. So the nerve impulses travel very fast, but in the endocrine system, the hormone system, the hormones are made by the glands, they get into the blood, and they travel more slowly, and they have a longer lasting effect. So a nerve impulse will cause a muscle to contract, and then it's done. But hormones can cause quite a long effect, They stay in your blood for a while. Then, so that's what the next part is. Then, nerve impulses are going to cause that muscle to contract. Not all the muscles in your body, but some hormones can actually cause many changes throughout your body. All right? There's not many neurotransmitters, those molecules, chemicals that move from one neuron across the synapse, the gap between neurons, which you remember, I'm sure, from grade 10. But there are lots of different hormones, and we are only dealing with the major ones. All right, so if we go now and look at my table, this is what you must learn from. And if you want to add extra notes, you can do that. But this is how you can easily revise the structure of the different glands. And please, we did not have enough questions in that test. You really, really do have to go and look at past papers. Okay, so the pituitary gland, that little gland at the base of your brain, it's actually in a little cavity. Little pituitary gland is in a cavity at the base of your brain. It's about the size of a pea, and it's often called the master gland because it regulates what other glands secrete. Like TSH causing the thyroid gland to secrete thyroxine, like FSH causing the ovaries to make follicles, like LH, which causes the ovulation from one of those follicles in the ovaries. Okay, you do not need to remember which part secretes which hormone. Okay, so growth hormone, it is from the front part, the little front part of the gland. It affects bones and skeletal muscles when you're growing, okay? Lots of growth and mitosis taking place. And if you have a lack of it, it's called pituitary dwarfism. So there's different types of dwarfism, but they would be very small in stature, and it's often picked up when they are babies. And then they could get growth hormone. They could get growth hormone medication. They can grow to nearly, sort of nearly normal height. Okay? If you get an over-secretion of growth hormone, it could cause gigantism. There was a program on TV where this 8-9-year-old was like nearly 7 foot already, and they realized, they took scans, and it was left so long because his parents were poor and they lived in a country where it wasn't easy to get to a hospital. And eventually he had a scan, and they saw that it was a tumor growing on the pituitary gland, and they did an operation. And they were quite worried, because it's dangerous to go in through and into the brain area. And they removed his that growth pituitary tumor, or the tumor on the pituitary gland. All right, and then they could see a few weeks later that the levels of growth hormone had actually become lower. Then you get over-secretion in adults. All right, in adults, they've stopped growing tall and longer, so now they grow sideways. So the bones of their face grow thicker, and their hands, and they get those really, really thick bones, and that's called acromegaly or acromegaly. Okay, potato. And I'll show you a picture of that just now. All right. Then another hormone from the pituitary gland is thyroid stimulating hormone. So let me do the same as what I did just now. I just want to keep that picture there because I don't want to redraw it again. Okay, come on. There we go. See it as I walk in front, it gets very shiny. So there's the brain, there's the hypothalamus, there's the pituitary, size of a pea. We don't need to remember anterior, posterior, but it secretes growth hormone, it secretes thyroid stimulating